1.
Page 163. Talonavicular joint. Dorsal glide of the navicular on the talus. Method number 2. Purpose: to increase dorsal glide of the navicular and to increase medial longitudinal arch. Precautions: do not apply too much digital pressure as this may be painful on the bony prominences.
Okay, simplest way to do this one is to use our index finger to come around onto the talus, like so. And then our thumb can go onto the navicular tubercle, which is right here. So thumb on there. Overlap with our other thumb, like so. And then we mobilize navicular dorsally, like so. So it's kind of resetting that navicular, because often the navicular drops down, reducing that longitudinal arch. So mobilizing it more dorsally is usually indicated. Not indicated with pes cavus, but with pes planus, it's certainly indicated. Okay. So I'll show that on our patient. First step is to palpate the navicular tubercle, which is right here. Index finger comes around to stabilize onto the talus. Other one comes around like so to reinforce your thumb, and then mobilize dorsally. Okay. Now, if your hand isn't big enough to wrap around onto that talus, then you can perform it like this, which might be easier for those that have a bigger distance from here to here.
Okay.
Okay, like that. You can try it both ways, see which way you're more comfortable with.
No.
Have a seat.
So,
Navicular tubercle. Yeah, you got it.
there.
Onto the talus.
Here.
Reinforce with the other thumb. Put your head this way maybe so they can see.
Okay.
Okay, and then mobilize. Excellent.
Oh yeah.
You got it.
Yep, I could feel that.
See how that comes out?
Yeah.
That navicular often drops down towards the floor, and you get a drop of that navicular, and this helps to restore that proper functioning of the foot and that medial longitudinal arch.
Mm-hmm.
Excellent.